Welcome to Marian Ayurveda. In this first episode, what I want to discuss is about the right time to apply oil. Many times we experience back pain or pain after eating. During such times, we apply oil and get some relief. However, often the severity of the disease and the nature of the illness also matter. It can actually end up increasing the pain. I am Dr. Anumod Kakkassery Marian Ayurveda Thrissur. In this first episode, we are also sharing the experience of a person who came to our hospital and recovered from their illness. This individual had been bedridden for about 18 years. That is, they were seeking treatment for a disc bulge. After that, they went to various hospitals, tried Ayurveda, and also tried different modern medicines. As a result of all those treatments, the body was in a state where it was filled with fluid. That's the condition in which they came to us for treatment. So in this video, I intend to explain when exactly oil should be applied to the disc and what are the conditions in which oil application should be avoided. Often when disc problems occur, it is a mechanism of the body. Fluid accumulation in the body is part of this process, and the pain that results from it is also part of it. Why does the body do this? If we understand the reason behind it, we can see that after this fluid accumulation, the body restricts certain movements, and as part of reducing the impact of the disc on the body, the entire body becomes filled with fluid. This is what we usually observe first when patients come in with disc issues. There will be a fluid retention in the body, and during this time, Ayurveda suggests that oil should not be applied when there is such fluid accumulation. This is one of the theories in Ayurveda. The reason is, we know that when there is fluid in the body, applying oil, which is also a kind of liquid, on top of that can cause the fluid to become more solidified or stagnant. In Malayalam, in common language, people say that the fluid will harden or turn into a stone, referring to this process. The fluid becomes even more concentrated and stronger. As a result, the patient experiences more pain. Then we tend to apply even more oil. This in turn increases the fluid in the body even further. Such a condition where the whole body accumulates fluid is often considered more dangerous than disc bulge itself. This is the state where the body is retaining fluid. So whenever patients come to our hospital, even if there is a disc bulge visible on the MRI, the first thing we do is some individuals may not have much fluid accumulation. If there are only small swellings, we can proceed to oil treatment within just 11 days. At the same time, when certain individuals come in, sometimes we may need about 3 days. Only after completing the fluid draining treatment without using oil can we proceed to the main treatment of disqualification. Sometimes for some people, like in the experience of one person that we are going to share in this video, we did not apply any oil for about 14 days. For all those 14 days, the only treatments we did were the fluid draining therapies. Each day as the fluids were drained, the body pains gradually decreased and the person was able to walk, sit, and turn more easily. They experienced relief as well. So let's move on to that video now. Now with me here is Mannuthy, right, from Kottayam.
Yes, I believe it was right here, yeah, wasn't it?
That's nothing, okay.
On the Ernakulam Road.
For the very first time here in our community, we held a special webinar session together with our Mariana.
Yes, we did.
That was back in 2021, right? Back then, there were some difficulties. What were those challenges?
If I talk about the difficulties, my whole body, except for the hair on my head, everything below that was in pain. Not just pain, but also a terrible burning sensation in my throat. At that time, even doing my own personal things was difficult for me. Many times I had to depend on my daughter to comb my hair and help me get dressed. And then, after lying down, it was extremely painful for me to get up. My whole body would ache and burn. I would keep thinking about how I was going to get up. It was very difficult getting up from there, and then after that it would take about half an hour. Right? At the very least, I would have to sit somewhere for half an hour, then slowly getting up from there, holding on to things for support. And after walking a little bit with great effort, I would start to feel a bit more awake. Then I would pick up and put away things here and there and so on. After struggling like that for a long time, I thought I should go somewhere and get some treatment. By then, I feel like I must have seen at least 15 or 35 doctors. There was Ayurveda, allopathy, and within allopathy itself, I saw a physician, an orthopedist, and a neurologist. Then I also saw several doctors in Ayurveda, including some very famous ones. But none of that really helped me enough. I feel like it's been about 10 to 20 years now. So by now, the body has gotten so used to it, if you put water on it, it feels fine. Maybe it's because I've been lying down for so long that I feel like I might get results quickly. Then, while I was sitting like that, my brother was the one who told me about this. Now, when another website came up, he told me, "Sir, just give them a call and talk to them once." At that time, I was reluctant. I didn't want to go for any more treatments. That's what I said, and I was just sitting there. Then my brother said, "Anyway, sister, just try giving them a call and talk to them. There's no harm in that, right? Then we can find out about our illness, how the treatment works, and whether this is a place where we can actually get treated. When we check it out, we can also find out if there's anything special about this or if there are any different kinds of treatments or anything like that." So in that case, when we called Sir, he said that if you have an MRI and all, you should come here and get it checked. So we immediately came here, met Sir, and talked to him. Then Sir said, no matter how old the disc problem is, we can fix it through treatment. That gave me confidence, and I started to feel hopeful right away. I felt a sense of happiness in my mind. Then we immediately got ready for the treatment. The very next week, we got admitted. Then at first,
When we first arrived here, I wasn't even able to climb up those steep steps.
I couldn't climb the steps, so when they said the room was upstairs, it was a problem for me. We faced some difficulty because I was wondering how I would manage to climb the steps and all. Then my son encouraged me to try. First, I climbed the step and held on with both my hands for support. At that point, my leg wouldn't lift up, so then my daughter, who was with me, helped me from behind to climb up. So slowly, I held onto the left rail with one hand and the right rail with the other, and with my daughter giving me a bit of help from behind, I climbed each step one by one, placing my foot on each step, and that's how I managed to get into the room. Then, after that, when it came to going back down, I was told that only after taking this treatment for several days would I be able to go down. After that, I was able to go down easily, and from that day until today, I haven't had any difficulty climbing steps. Not a single problem has come up like that. That was the biggest thing for me, that first treatment back then. If I were to say what I experienced as the greatest benefit, when I came there, it had been almost 18 years. Now it's been about 20 years. So it was after about 18 years there that the illness started, and if you consider that, I had never had such an experience in all those years. For me, after lying down, I was able to get up without any pain. That's what mattered. Like I said, even if it was afternoon, if I lay down for a while, by the time it was 2:03 and I tried to get up, I would think, who will come and help me up now? Because I couldn't even move. But this is something we can't say outside. We can't tell anyone about it. When people see me, no one would think, can I cry? Will someone come and help me up? Will someone come and help me sit up, help me stand? At that time, I couldn't say any of this to anyone. That's why I just lay there, unable to do anything. Even if I wanted to turn or move, I couldn't do it. Back then, I could only lie there, and even now, when I lie down, I slowly and gently shift my position a little bit backward. Without even realizing it, my body would slowly lean to the right as I lay there. That's how I used to lie there all the time. So after our first treatment, I haven't had that problem again until now.
Right on my head, I
haven't applied oil.
apply oil.
I haven't applied oil, and now my hair has turned gray. That's just how it is with age.
The hair fall has also reduced quite a bit, hasn't it?
It has reduced a lot, a whole lot. So if Sir says it's completely cured and you stop the treatment, then it will never come back. No matter how many years pass, even if you get older and your hair turns gray, this will be completely cured. But as for whether it will come back, who can say? In that matter, Dr. Kallis was very confident. He was sure about it. No matter how many ways you look at it, for us, it can be corrected. Now, after I mentioned what my main problem was, all the fluid was drained out. That was the biggest relief for me. That's why we spent more time on that. So after that fluid was almost 90% removed, we proceeded with the treatment. So for me, that was a huge relief. Even now, when I think about it, I feel a sense of relief. When you get even a little bit of relief, you feel like you can get things done. At that time, there were also things I couldn't do, and the doctor told me not to lift any weight. It would be best not to suddenly lift weights or do anything like that. Then, washing clothes on the stone, bending down to sweep the yard, those kinds of strenuous tasks, the doctor told me it would be best to avoid them, but I didn't really pay attention to that. So whenever I felt a little better, I would go ahead and do even those tasks I wasn't supposed to do. For example, when we put rice in the cooker, I would do that too. There are all these chores to do. So after a long time had passed, I started having some difficulties. All those things, even now, have started to happen like that. Because I kept ignoring it and kept doing those tasks again and again. That's when it started to spread and get worse. Then, by the time I came for the second time, it had changed like that. From that day onwards, it has continued like this, and I have been managing it. If it gets worse or becomes very severe, then I come here, call sir, and come in. Now, it's only been about 234 days, right? When I compare how I feel now to before, I feel much better. When the pain lessens, I feel more awake and alert. So that itself gives us a lot of hope and expectation, doesn't it? So right now, there isn't much of a problem, not a big problem at all. Now I feel like I can do all the necessary work.
So this person, after about 2 or 3 years after the first year, even without treating the disc, they experienced a lot of improvement. In the second year, we gave them a disc cubilin treatment. After that now, after about 1.5 to 2 years, when they developed some urinary retention, they came to our hospital. They came for 2 or 3 days of treatment. In just 3 days, they became fresh. Compared to the person you see now, their swelling was much worse. They were in a very swollen state. When we first saw this patient about 23 years ago, they were in that condition, but now they've changed, become thinner, and there is no swelling at all. At that time, we gave them a strict instruction: after leaving here, do not apply oil to the head or body because it is not necessary. Applying oil externally on the body like that cannot reach the disc or have any effect there. Only when we do the treatment in a specific way, in a particular style, can we address issues like fluid retention or dehydration. So what this person said was that fluid retention was their biggest problem. It was even more dangerous than the disc bulge at that time. It's been 2 or 3 years since I've applied curry oil on my head, or I haven't applied oil on my body either. We are following that particular style. That's why it's maintained in such a way that the medicine doesn't penetrate inside. So what I want to say to those with disc issues is that before applying any oil on the body for pain, you should first assess for yourself whether there is fluid retention. Otherwise, you should consult a good doctor before starting any treatment. Let's meet again with another episode. Thank you.